Yeah, welcome to Childcare Development Tribal Plan. This is section 5, part 1. In this section, we'll be covering childcare and family eligibility and priority, along with discussions around the new CCDF rule on income eligibility flexibility. There is also a part 2, which will cover other components within section 5. So be looking out for that particular video and recording, and hopes that that will be super helpful. Just as a reminder, this section of the plan applies to the tribal lead agencies that have that are medium and large allocation. So again, welcome everyone. You are in the training video for helping you get your Section 5 plan written. So in hopes that this video will be helpful in questions that you might have. And if there are additional questions and you're not hearing it from the video, please do connect with your regional program specialist. Here on the screen, we will now cover objectives that are going to be covered in this particular presentation. Tribal lead agencies have a great flexibility in how they will create a comprehensive CCDF program that best meets the needs of their nation and community needs. As you are in this session and other sessions throughout the particular videos and trainings for a tribal plan, you're more than welcome to, again, think about your tribal nation's vision for childcare, especially who are those children and families that you will be serving throughout this new tribal CCDF plan. We also just want to invite you to consider how to utilize the flexibilities and the CCDF requirements that best meets the needs of children and families. You'll see in these slides that there's that word considerations in the title of the heading in our presentations and other presentations. These are areas that are not CCDF requirements, but highlight the flexibilities and the options that you could think about as you develop your CCDF plan. So again, to maximize the assistance in providing the amount of support, please connect with your OCC and TCBC during the time that you have available, and kind of set aside some TA support around your CCDF plan as moving forward. So again, in this particular training session, we will help to have you understand the CCDF subsidy eligibility requirements and flexibilities that include topics on standard eligibility, categorical eligibility, new income eligibility, flexibility, prioritization of CCDF services, graduated phase out of care, and then also in hopes that you understand what sufficient responses are within Section 5 and build awareness around that so that implementation stages of CCDF requirements are met. Great. On to the next portion of our plan is the standard eligibility requirements. The plan section of 5.1.1 asks us about the basics of the tribal lead agencies using the uses of determining eligibility for CCF assistance. The two main methods exist. We categorize these as standard or categorical eligibility. What is standard eligibility? The CCDF rule states that in order to receive CCDF services, children must be an Indian child residing in the CCDF service area as defined by the tribal lead agencies in Section 1 in your tribal CCDF plan. The child must be under the age of 13 or up to 19 if physically or mentally incapable of self-care or under court supervision, residing with parent or parents or someone acting in local parentis, and who is working or attending job training or educational activity, or is receiving or in need of receiving protective services. We refer to this as standard eligibility requirements. Tribal lead agencies have the flexibility to establish additional eligibility criteria. Additional eligibility criteria can only be considered at the time of initial eligibility determination and at redetermination. It is important to establish policies and procedures so eligibility criteria is applied consistently in the administration of the CCDF program. One difference you might note from this last plan is that we did not include income eligibility criteria in this list. So just be aware, we did skip forward skipping and forwarding over to the 5.1 to discuss the income eligibility flexibilities that were provided in the CCDF final rule. Again, that was published in November of 2024. Here on this slide, since the beginning of CCDF program, standard eligibility requirement also included an income eligibility limit. Family incomes had to be less than 85% of the grantee median income, and a family could not have assets above the 1 million in value. A new rule that was published and became effective on November 18th of 2024 provides new flexibilities for tribal lead agencies with medium and large allocations. The change provides tribal lead agencies with more flexibility to better meet community needs, address calls for greater tribal sovereignty, and facilitates better alignments between tribal CCDF and tribal Head Start programs, and also response to requests to ACF from tribal leaders and tribal CCDF lead agencies for more flexibility on family eligibility so they can design childcare programs to better meet community needs. The new flexibility, all tribal lead agencies have the flexibility to serve Indian children as defined by the tribal lead agency in their service area, regardless of family income or assets. With this new flexibility, it's important to explore how you're going to decide within this plan section and other pieces that impact services to children and families. Here on this next slide, the new flexibility does not require tribal lead agencies to change their eligibility policy. The new flexibility does not change existing tribal categorical eligibility flexibilities or eligible activity requirements for CCDF. The children or child must still reside within the parent or legal guardian who is working in or training or attending school for tribes with medium and large allocations. Some potential actions by tribal lead agencies could be none or no action, meaning tribal lead agencies keep existing eligibility policies or policies. Another is change income eligibility threshold to either increase, decrease, or remove. And then change to asset limits to increase, decrease, or remove. Again, here on this next slide, this is just a review of what we just discussed. Look at this summary of the new flexibility. The new rule allows all tribes the option to serve Indian children in their defined service area, regardless of family income or assets. We will talk later within this presentation about consideration for changes to your subsidy program, given these new flexibilities. If we jump ahead to section 5.2.3 of the plan, you will note that you are asked if you use income to determine eligibility, and if yes, you are asked about the percentage of the median income that is used for determining income or initial eligibility determination. So this particular slide can be a really good way of using it as a summary of what was just mentioned in previous slides. So let's jump back to the plan of section 5.1.1. Earlier we shared the criteria for standard eligibility. If standard eligibility only is selected in 5.1.1, then 5.1.3 and 5.1.4 are skipped. So again, looking at 5.1.1, what about the second basis for determining CCDF eligibility within categorical eligibility? Tribal lead agencies may opt to use standard eligibility requirements, as we've discussed, or if they are able to demonstrate that the tribal median income, the TMI, is below 85% of the state median income, which is SMI, they may opt to use categorical eligibility requirements. For any child that meets your definition of Indian child and who lives in the service area could be considered eligible to receive services, regardless of family's income, work, or training status. So plan section 5.1.3 is the section in which tribal lead agencies demonstrate what they meet the requirements that 100% of their TMI is below 85% of the SMI. The information must include the data source that are used to support the demonstration. It is important to note that categorical eligibility applies to tribes with medium and large allocation, while tribes with small allocation have broad flexibility of defining eligibility requirements. As determined by tribal leadership, and are exempt from the demonstration of tribal median income. Tribal lead agencies also have an option to use a different basis for determining eligibility in different parts of the service area, or tribal consortium may establish different eligibility criteria based on the preferences of its participating tribes. With the new income flexibility, really the only way or reason to offer combination of both standard and categorical eligibility is to offer categorical eligibility in one part of the service area and standard in another area. As we continue on categorical eligibility requirements, if a tribal lead agency demonstrates that it is eligible to use categorical eligibility as the basis for determining eligibility, the following eligibility requirements apply. The child meets the definition of Indian child. Another is permanently resides within the CCDF service area at the time of initial eligibility determination and redetermination, as well as the child's under the age of 13 at the time of eligibility determination and redetermination. And all tribal lead agencies may provide care to children up to the age of 19 or 18 and younger who are mentally or physically unable to provide self-care or is under court supervision. Another is flexibility to establish additional eligibility criteria. So as with standard eligibility, additional eligibility criteria can only be considered at the time of initial eligibility determination and at redetermination. It is important to establish policies and procedures so eligibility criteria is applied consistently in the administration of the CCDF program. So just want to make note, in the plan, those tribal lead agencies that opt to use categorical eligibility only will complete 5.2.1 and 5.1.4, which addresses any additional eligibility criteria that is established. They will then skip 5.2.2 and 5.2.3 and 5.2.4. Just want to make note that you would want to use the tribal plan guiding information that is available as well, in hopes that becomes very super helpful. Other CCDF requirements continue to apply. So CCDF prioritization, continuity of care, which is in section 5, part 2, and then equal access is in section 6 requirements. What other requirements continue to apply? At a minimum, tribal lead agencies must prioritize children with special needs and children experiencing homelessness. All other CCDF eligibility and equal access requirements apply. We will dive more into these particular sections of continuity of care in part 2, and then we'll explore equal access in Here is categorical eligibility. Is it a good fit? There are a number of considerations for your program and partners to discuss if you are interested in pursuing categorical eligibility. And you'll see here on the screen some guiding questions that can help you think about whether choosing categorical eligibility would be a good fit within your tribal lead agency and community. The question is quite critical in considering implementation for categorical eligibility. You'll want to identify if you have existing funding in your CCDF budget to serve more children in your CCDF tribally operated center and or subsidy program. If you do not, do you have tribal dollars or any other funding sources that would support serving more children? TCBC has an optional CCDF budgeting tool to help you see if you can afford to serve more children. So be sure, if you are interested in that, to contact your regional program specialist to get some TA support around that. You will want to discuss whether families currently face challenges in qualifying and applying for CCDF services. Are you turning families away due to not being engaged in eligible activities? Do you track the reasons why families are not determined eligible for CCDF services? And again, this is not an exhaustive list of considerations. What else would you need to discuss with your leadership and partners around, is categorical eligibility a good fit? You might have noticed that we've skipped over 5.1.2 and note that 5.1.2 will be discussed in our Section 5, Part 2 presentation. So let's discuss CCDF eligibility criteria for tribal lead agencies and choose other standard or categorical eligibility. The age of children served. CCDF assistance is for Indian children less than 13 years of age in the defined service area. Tribal lead agencies have the flexibility to serve children under the age of 19 who are physically or mentally incapable of caring for himself or herself or under court supervision. Tribal lead agencies define physical or mental incapacity in the plan. The definition should assist you in answering these questions. If we are serving children over 19, other than those that are under court supervision, which doesn't require a definition in the plan, who are those children? Physically or mentally incapacity. An example to mention is physical or mental incapacity means a condition that affects the ability of children to care for themselves, a dysfunctional condition which disrupts a child's typical development patterns during which the child cannot function without a special care or supervision or documentation by a physician or local education agency is required. Other eligibility terms, CCDF assistance for children residing with parents or someone acting in local parentis who are engaged in eligible activity or who are in need of or receiving protective services. Tribal lead agencies define residing with and in local parentis in the CCDF plan. I will just mention just a few examples to reference about the examples of flexibility. So residing with, an example mentioned in the CCDF program defines residing with as to be in a residence to dwell permanently or continuously to occupy a place as one legal domicile with family. Another dimension is residing refers to person with living with or another in the same household permanently or continuously for an extended period of time. Let's jump over to local parentis. An example is the CCDF program defines local parentis as an acting or done in the place of a parent. Any individual who assumes responsibility for a child, such as a foster parent or an other guardian. This can also include formal or informal services for the child. Another example for local parentis is local parentis describes a person that is standing in the shoes of the child's parent or a child's non-parent caretaker that has all the rights, duties, and responsibilities to a child that a parent would have. So with that, I will turn this portion of our presentation over to Selena to take us through the next few slides.
Thank you, Dolores, for sharing your portion of the presentation. So moving on to this particular slide. This is our first eligibility consideration slide. When you see the slide, note that they are not CCDF requirements, but areas to consider for tribal lead agencies in defining policies. Household composition is not a required definition in the CCDF plan, but each tribal lead agency should have a definition in their internal policies and procedures. CCDF does not require that all individuals in a multi-family or multi-generational household be considered in the household composition, but tribal lead agencies may include if they choose. CCDF requires that any parent residing in the home with the child be included in the child's household. Parent is a blood, biological, marriage, step, or court decree that includes foster and guardianship and adoption cases, includes individual acting in local parentis. In a two-parent household, both parents must be engaged in an eligibility activity. Tribal lead agencies have the ability in an extraordinary circumstances on a case-by-case basis determine a child eligible for CCDF if one parent is engaged in an eligible activity. The next slide, please. We will start on this slide, and it talks about eligibility criteria, reason for care. Tribal agencies that use categorical eligibility as a basis for determining eligibility do not have to complete plan section 5.2.2, which covers reason for care, 5.2.3, which covers income limits, and 5.2.4, and that covers additional eligibility criteria. If you utilize only categorical eligibility, you are welcome to listen as well. Just know you do not need to address these plan sections that are just mentioned. For tribal agencies using standard eligibility as a basis for determining eligibility, at the time of eligibility determination and redetermination, the child's parent must be engaged in an eligible work, education, or job training activity, or the child must be considered as being in protective services. Neither the statute nor regulations governing CCDF define work, education, job training, or protective services. Tribal agencies define these terms in the plan. Tribal agencies must have policies and procedures in place to verify any information provided at the time of eligibility determination and redetermination, including parental participation in an eligible activity. CCDF regulation forbid the ongoing collection of documentation outside of the eligibility determination and redetermination process, including the submission of work schedule during the eligibility period. The Office of Child Care has an information memorandum, an IM, on tribal CCDF lead agency flexibility for CCDF parental activity requirements that was published on January 9th that discusses these flexibilities in more detail. You can go to those particular resources and website which are provided online. The next slide. Tribal agencies may consider a wide variety of situations in defining work, including situations beyond traditional wage-based employment, such as participation in subsistence activities or self-employment, including the production of traditional items or crafts designed to be sold for income. Another one is participation in remote, temporary, substitute, or day labor work, or participation in volunteer activities. Please note that these are not exhaustive lists. The next slide. Tribal agencies may consider a wide variety of situations. Additional examples are provided here, such as providing care to elders or individuals with disability, participation in the military, including the National Guard or Reserve Forces, or else participation may be on medical leave from their employment, such as for maternity leave. Again, the list is not exhaustive. Going on to the next slide. Tribal agencies can determine their definition of job training. Some possible activities are participation in a paid or unpaid internship, apprenticeship, or other hands-on training program designed to train individuals in a particular skill or field, including native language, culture, and traditions. Another one is participating in job training programs through federal, state, tribal, or local program designed to increase employment opportunities, such as temporary assistance for needy families, or with Workforce Innovation and Opportunity Act programs, or other Native Employment Works program. Participation and rehabilitative services that focus on developing skill is another one, which are necessary for workforce participation, such as vocational rehabilitation program. And the next slide. Possible activities to consider for the education section is part-time or full-time enrollment in college or educational courses, including those delivered virtually, enrollment in a trade school or other educational program, participation in a professional educational certification program, such as a child development associate, enrollment in tribal language or cultural classes, and enrollment in high school classes or general educational development programs. This is not an exhaustive list. Tribally agencies may provide childcare to children where the parent is engaged in job search activities at the time of eligibility determination or redetermination. A separate definition of job search is not required in the CCDF plan, but can be included as part of the definition for working or job training. Should the parents become employed or engage in a separate eligible activity, such as education or job training, during the 3-month job search period, the child services must be continued for the full minimum 12-month eligibility period. Tribally agencies cannot reassess or redetermine a child's eligibility for services if the parent engages in an eligible activity during the job search period. The next slide. As a reminder, tribally agencies do not need to include our requirements in their definition of eligible services. In defining work, education, or training activities in the CCDF plan, we encourage you to take a different approach than in prior plan cycles, while not including hours within the definition, but instead to focus on the types of activities that are allowable, such as activity hours required may vary across categories as long as they are applied consistently across all individuals. Another one is a tribally agency may choose to require full-time participation in educational activities, but allow for part-time work participation. Reminder, tribally agencies may not require a parent to submit documentation of ongoing participation in an eligible activity. We're going on to the next slide. Here, we are going to discuss some parameters for when the reason for care is protective services. Remember that children must be residing with a parent who is working or in an education or job training program, or the child's need is to be receiving or in need of receiving protective services. These families are those families in which the parents do not need to be engaged in an eligible activity, and those families do not need to be just who we traditionally think of when thinking about protective services. To be included in the tribally agency's protective services definition, the group must be a specific subgroup of children. If a tribally agency has a broad definition of Indian child, they cannot include members of their tribe as long as a subgroup within their protective services definition. Now we will discuss some options for consideration to include in your definition of protective services. And Plan Section 5.2.2 provides a list of potential subgroups of children that could be included under protective services. There is a checklist to ease your response, but it's not an exhaustive list. Feel free to include a description of other subgroups. Tribes have the discretion to define this in a way that reflects and meets your people's needs. Here are some examples. Children who have been referred to tribal or state child welfare but remain in the home, children of adolescent parents, children experiencing homelessness, children of parents with a disability or medical or mental health condition that requires additional support in caring for the child, children with a parent engaging in an inpatient or outpatient substance abuse or mental health treatment program, and lastly, children being primarily cared for by their grandparents, or they may be in kinship care placement or in a foster care or through legal guardianship or adoption. This includes state and tribal adoptions. Here are additional examples. Children residing in a home where domestic violence has occurred, children residing in a home where the family income is below the level defined by the tribal lead agencies as being low income, children participating in early childhood or school age partnership program. An example is like your tribal early Head Start program, having a partnership with childcare. Another example is CCDF and school age care partnership. Again, this is not an exhaustive list. One example we are hearing more about is including children of the child care workforce. We encourage you to review the IM again that offers more details on these considerations, and that is on the tribal CCDF lead agency's flexibilities for CCDF parental activity requirements, which was published on January 9th, and it discusses more flexibilities. And the resources are on our website. In section 5.2.2, the tribal plan asks for the tribal lead agency uses CCDF funds to provide respite care for children and protective services. A simple yes or no response is sufficient, but a reminder that this is the only subgroup of children who can receive respite care. Children that meet the definition of special needs do not qualify for respite care unless they also meet or include under the definition of protective services. To summarize, tribal agencies have substantial flexibility in defining what each of the eligible activities are. Again, these are only some examples for consideration, and this is not an exhaustive list. The Office of Child Care encourages tribes to partner with their leadership, families, and community to discuss what activities should be included under these 4 categories. Going on to the next slide. We earlier discussed it in Plan Section 5.2.3 as it pertains to income eligibility limits and flexibilities. Jumping ahead, Plan question in 5.2.4 asks about additional eligibility criteria established by tribal lead agencies using standard eligibilities. Those using categorical eligibility share additional eligibility criteria in section 5.1.4. Note that this is perfectly fine to respond no, that there is no other additional criteria beyond CCDF requirements. Tribal agencies have the flexibility to establish additional eligibility criteria other than those required by the CCDF regulation. Some consideration of the additional criteria are an income or asset limit. If you set an income limit, you're likely already established it in section 5.2.3. Please note, if the tribal lead agency decides to implement an income eligibility that is lower than 85% of the grantee median income, then other requirements will be applicable. We will discuss those in a moment. Another additional criteria to consider is enrollment in the tribe's preschool or other education program. And another consideration is enrollment in the tribe's Head Start program. So on this slide, here are some things to be aware of when establishing the additional eligibility criteria. Additional eligibility criteria cannot discriminate against the child on the basis of race, national origin, ethnic background, sex, religious affiliations, or disability. And you cannot limit parental rights. You cannot violate any of the provision found in the CFR regarding the eligibility determination and redetermination process. You cannot violate the provision found in the CFR regarding the prioritization of children with special needs or those experiencing homelessness. You cannot violate the provision of subsection 98.46 in the CFR. In particular, it relates to such condition or priority rules, which may be based on a parent's preference for a category of care or type of providers. In addition, such additional conditions or rules may not be based on the parent's choice of a child care certificate or prioritization based on the parent's choice of which category of care to or provider to utilize, or choice of a child care certificate, except as authorized for the tribally agencies receiving a medium CCDF allocation. Medium allocation, as they have the flexibility to offer CCDF through a tribally operated center only. Another additional eligibility criteria that cannot impact eligibility other than at the time of eligibility determination or redetermination. We mentioned earlier that if a tribally agency sets income limits of less than 85% grantee medium income, additional requirements apply. One is that they must have a process to take into account for irregular temporary fluctuations in incomes or earnings for initial and at redetermination. Plan section at 5.2.3 asks about the process the tribally agency uses to take into account of these fluctuations, which are average the family's earning over a period of time, for example, 12 months. Request earning statements that are most representative of the family's monthly income. This could look like asking the parent to admit pay stubs that include a one-time or circumstantial bonus, or a paycheck where the parent had mandatory overtime for a time-limited period. Another one is deduct temporary or irregular increases in wages from the family's income level. Another one is any other way of accommodating irregular fluctuations. Remember, the goal is to support a family's stable access to childcare state services. And again, this only applies if you set your income eligibility below 85% of the grantee median income. You might have noted that Plan Section 5.2.3 requires that if a tribally agency establishes initial family income eligibility below 85% of the grantee median income, must provide a graduate phase out of assistance for certain families participating in CCDF. The response requires a description of the graduate phase out process, including methods for informing families and providers about the process. This requires a two-tier eligibility approach. Sudden withdrawal of support can destabilize and undermine a family's pathway to financial stability. Providing a graduate phase out promotes continuity by allowing for wage growth and a tapered transition out of the two-tier subsidy program. and supports long-term financial stability to help families get to a point where they no longer need the subsidy. While tribally agencies setting income eligibility at less than 85% GMI must provide a graduate phase-out of assistance, all tribally agencies have the flexibility to implement a two-tier approach. A two-tier eligibility process means that the tribally agency establishes one level of eligibility at initial determination and a second higher level at redetermination. The tribally agency provides a gradual phase-out of assistance to families who, at the time of eligibility redetermination, meet all non-income related eligibility criteria and whose income is above the initial income eligibility limit, but still at or below the tribally agency's second tier of eligibility. Note, during the graduate phase-out, those tribally agencies may increase co-payments and require additional interim reporting. Are there any tribally agencies that currently have an income eligibility limit of less than 85% of the grantee median income? And that concludes our discussion on section 5.2. Moving on to section 5.3, note that we're going to discuss section 5.3.1 in our part 2 presentation. Plan question 5.3.2 asks about priorities tribally agencies have set for CCDF eligibility. Tribally agencies must prioritize specific families but have additional flexibility to prioritize additional families. Prioritization requirements are applicable whether your program chooses to use standard eligibility, especially given the new flexibility to serve all incomes. Or if you choose to implement categorical eligibility, you might recall from our earlier discussion that in order to utilize categorical eligibility, tribally agencies must ensure that CCDF services go to those with the highest need. Prioritizing family is one way to do that. In the column on the left, you will see CCDF requires tribes with medium and large allocations to prioritize families experiencing homelessness and children with special needs. You are not required to have additional priority categories, but if you choose to, you have brought flexibility in defining what those are. The column on the right displays a few examples of potential priority categories. This is, of course, not an exhaustive list. We want to flag here too, tribally agencies who include the Indian children from tribes outside of the tribally agencies in their definition of Indian child for child count purposes. You cannot prioritize and or limit CCDF services to children who are citizens of that tribe. For instance, if a tribally agency's definition of Indian child is all citizens and descendants of any federally recognized tribe, the tribally agency cannot then limit or prioritize CCDF services to only those children who are enrolled in or citizens of the tribally agency tribe. There are other considerations to think about when making eligibility decisions. CCDF is a block grant with limited funding. If your program prioritizes enrollment for CCDF services and or chooses to implement minimal eligibility criteria, like removing or greatly increasing the income requirement, there is the potential that your funding might not be enough to cover the demand for services. We strongly encourage you to consider developing waitlist and enrollment freeze policies in case they are needed. In theory, implementing a waitlist can ensure a fair and effective method by which a program can control the size of the population being served. Waitlist policies should include clearly defined priority groups. Having a waitlist policy and our process allows priority groups to move to the beginning of the waitlist ahead other children who are not in a priority group. Enrollment freezes can be implemented when funding is not available to provide childcare services to all eligible families. In the event of an enrollment freeze, no new application will be approved. However, existing childcare families may continue to receive childcare. Let's move to the next slide. Again, this is another list of things to consider. If your program has more children eligible for CCDF service than there are program funds to serve each child, the decision to freeze intake or establish a wait list should balance the need to conserve funds with what has been the least impact on parents and childcare providers. The primary objective is to select the method that maximizes the use of available funding to serve the greatest number of families. Tribes should consider a number of factors when developing a strategy for limiting intake. Some questions to consider are: what method maximizes the number of families and children that can be served? How long will the program stop accepting new enrollments? Waiting lists become less effective the longer the program remains closed. Another question is, does the tribe have authority to close the wait list if it becomes too large to maintain? What processes are in place to provide notices to waitlisted families? When the childcare program reopens, is the application volume predictable, and does the tribe have enough resources to process the influx of applications timely? And the last question is the tribe able to handle the increased call volume from parents, providers, and advocates? And now I will turn the time over to Dolores to cover the next slide.
Thank you, Selena. Just want to say now that we're wrapping up our Section 5, Part 1, just thinking about what additional information do you need to fill out Section 5 of the plan concerning the standard eligibility, categorical eligibility, prioritizing CCDF services, optional income eligibility, and what partners might you need to connect with about this section? And also, what questions or topics would be helpful for you to discuss with the Office of Child Care? So again, plan to attend and listen into these recordings for support around Section 5. This concludes our presentation for Section 5, Part 1. Thank you, everyone.